were here early. I get to pass the time on to Alicia and Rachel. They serve as coordinators for treatment courts within the 6th district, and they're going to dive into a more in-depth look at what the treatment courts do. So thank you for having me today. I look forward to the presentations.
Thank you, Judge Anderson, for the wonderful introduction. It was great. My name is Rachel Barta. I am the program coordinator for the South St. Louis County DWI Court. Did you want to introduce yourself, Alicia?
Good morning, everyone. I'm Alicia Ward. I work with Judge Anderson up on the range and am the coordinator for our hybrid and mental health courts up there.
Cool. Thank you. Vianna, if you could go to the next slide. I just wanted to have everybody have an opportunity to do a poll. And we were just curious before we start, how familiar are all of you with the treatment courts? Is this something that you know about, that you're really familiar with? You've never heard of a treatment court before. You don't know what it is or what we do. Then that way it'll give us an idea of how deep to dive, I guess, into the nuances of the treatment courts and what we do. So I think you should be seeing a poll here shortly.
Hi, Rachel. I'm not seeing the poll option right now. It may not have saved. It's something I can look and see if we can fix.
Okay.
But looks like people are voting.
Yeah, people are using the chat, so that's okay. We have someone who used to be a probation officer with tax court, I think. Some people are slightly familiar. This works too. So there's a little bit of familiarity. Mary Jo is a 5. Jenna Dickinson, slightly familiar. Cool. All right. Vianna, if you go to the next slide, I wanted to talk about something that Judge Anderson mentioned, which is that treatment courts are the single most successful intervention that we have in the criminal justice system for people with substance use disorders and mental health issues, and getting those folks out of the criminal justice system and into a life of recovery. And I started thinking about that and I thought, well, why is that? You know, why is the work we do so successful, not just in Duluth, but also on the range? And as I thought more about that, I thought one of the reasons is the unique approach of the treatment courts. Traditionally in the criminal justice system, with people who are on traditional probation, you'll see a really big focus on external motivators. That's things like electronic monitoring, giving urine drug screens, doing probation field checks. And the treatment courts do utilize these approaches. They're really critical in terms of the way that we measure participant accountability. But something that's really important to note is that those external motivators are really compliance-based. And what compliance-based means is it's someone who's doing what they're told. They're following instructions. They're doing something because someone else is telling them to do that. And while that is a really crucial part of the treatment courts, we take it a step further than that. And that's the really cool thing about treatment courts, is that we go beyond those external motivators to more internal motivators, things that motivate people in their personal lives to pursue a lifestyle of recovery. These would be things like personal health, personal well-being, being a better mom, being a better dad, being a better niece, nephew, uncle, family member. And the difference between internal motivators and external motivators is that internal motivators are based on a philosophy of adherence, and that's different from compliance. Adherence is something where people are internally motivated to make an active choice in their own recovery. They want to take personal responsibility for their life and for the trajectory of their life. And that's important because it creates an opportunity for people to make positive lifestyle changes, which is really crucial to recovery. And if we can go to the next slide, I wanted to talk about different ways with Alicia that we can capitalize and that we can identify and capitalize on internal motivators. Did you want to start, Alicia, or should I go? I could go forever.
I I'll go and you just add on because I know you have some good things you want to add in here too. So
Sure.
identifying and capitalizing on those motivators. So alternative approaches and supports. We have a lot of unique partnerships. One that I'd mentioned that we have up on the range is we have a really unique relationship with the college up there, a project that actually offers scholarships to participants to kind of, engage them to pick up their education again, see what they're interested in. But on a district-wide level too, we offer a lot of education for participants that explore areas of financial literacy, employment, family dynamics, housing, different factors outside the substance use disorder or mental health that can impact somebody's ability to achieve long-lasting recovery and wellness.
Yeah, that's for sure. We used to do a Cooking Matters class where we would teach people about how to prepare healthy, nutritious meals on a budget. That was really a cool opportunity. So some of the other ways that the Duluth DWI court is willing to explore different alternatives or approaches. I was thinking this morning, we were participating in the Recovery Capital Project, which is an opportunity for our court to develop a new curriculum for participants in the later phases of our program and beyond, so that we can enhance some of the opportunities that they have for recovery. Another project that we're working on is the Court Voices Project, and that is designed to assess people's responses and the way they feel about our pandemic response related practices and things that we've changed since the pandemic, where we'll collect direct feedback from participants and team members. So that'll be another way that we would be able to identify some things that can really motivate people and improve trust and confidence in the courts, as well as enhance people's recovery down the line. We use a whole person approach, and I know you had some stuff you wanted to say about this too, Alicia.
Well, I just want to say for that whole person approach, we just really try to individualize our responses to the specific needs of each person, whatever that may look like, and taking time to understand them and meeting them where they're at when they come into our program.
Mm-hmm. And that really does result in better outcomes. In the DWI court, we take the highest risk, highest needs participants of any DWI court in the state. We take people who have felony criminal vehicular homicide or criminal vehicular operation charges. We take all people who have been charged with or convicted of a felony DWI. So we're taking some very high risk people into our court, and the outcome trajectory with the interventions that we use, yoga and mindfulness being one of them, is really, really positive. Most of our people graduate with jobs and they're contributing back to the community, and some have actually gotten jobs in the recovery community, which is really outstanding. So that's really an interesting part of that. And I think part of why the courts are so successful too is our approach to understanding trauma. And I know, Alicia, you had mentioned you wanted to talk about the training and things that we do.
Yeah, our district and all of our teams really prioritize bringing in education and training for all of our team members that on trauma-informed practices. And we just really strive to be intentional with our responses and just being aware that everybody that comes into these programs have experienced some level of trauma.
That's very true. Can we go to the next slide, Rianne? Thank you.
Okay, so our participants typically have experienced history of negative perspective viewpoint of the criminal justice system. Normally, they are really untrusting of the processes and of people in those positions of higher power law enforcement. Substance use disorders and co-occurring mental health issues, often undiagnosed, untreated. A lot of our folks have unsuccessful attempts at treatment. A lot of times they haven't ever gone through one program completely or graduated. Single or multi-generational parent families, situational and generational poverty, struggle to secure steady employment. This is really common with our participants. It may range from just lack of education, but lack of experience, but that criminal record is really what keeps a lot of our folks from getting back out into the workforce. Situational and generational trauma, ACEs, strained family relationships. The majority of our folks are dealing with this every day. So many of the people that come into our programs, a lot of them have lost their children, for example. They're working with CPS, their children are in foster care, they're trying to regain custody. They're trying to regain trust within their families. Difficulties securing housing, kind of the same thing with employment, that criminal record, and the financial piece of it too. And then deficits in emotional regulation, self-awareness, and healthy coping skills.
Right, that's true. A lot of people don't have or have never learned or had the opportunity to learn different ways to address emotions and feelings that are uncomfortable. And on the next slide, we'll talk about some of the most effective ways to heal trauma, I think. So knowing this, knowing that the slide that Alicia just talked about is sort of the template for most people who are going to be participating in treatment courts, we thought, well, what is a good way that we can enhance the trauma-informed services that we're already providing? What are some different ways that we can work to heal that trauma to give people the best chance at success in their recovery? And through our research, we thought we wanted to use an embodied approach to trauma. And there were some inspirations for that. One of those was mindfulness-based stress reduction. I'm sure several people are familiar with that already, but that's the pioneering work done by Dr. John Kabat-Zinn in terms of mindfulness and ways that can help to heal you. Giving, I guess I would call it sort of, I think he calls it actually an affectionate attention to feelings, emotional feelings, and also to bodily sensations that you may have. Paying attention to the breath, paying attention to your postures. And when you do these things, it gives you that greater self-awareness so that you're then able to begin exploring some maybe uncomfortable or hidden or buried feelings and emotions and begin to heal from that. Another big influence for us was the work of Bessel van der Kolk in his book, The Body Keeps the Score. And I know a lot of people are probably familiar with that also. That's the whole idea that people who are suffering, they don't just experience that feeling in their minds. That feeling is held, those feelings and feelings of trauma in particular are held in the body. You can see this in people's posture. Sometimes people who have been victims of abuse will cross their arms. In terms of the people in this room, who many of whom I'm sure have been working from home, I'm sure we've all adapted a posture that's kind of like this, where your shoulders are all scrunched up. Your body keeps a scorecard for all of the experiences that you've been through in your life. And when you acknowledge that fact, then you're able to begin addressing some of the trauma that's held within your body through alternative approaches like what we use in our courts, which is yoga and mindfulness. Sometimes people will also use exercise and going to the gym, that kind of thing. It's very healing. And we also wanted to use something that was evidence-based. The treatment courts are really focused. We strive to follow best practices in all that we do. We like to use proven techniques. It's not, the things that we do aren't just an idea that we had. There's research and literature to back it up. And I think that that's a big part of why we're so successful also. And on the next slide, there's a little bit of information about, I included a quote here from Kana and Greason in 2013 about how yoga and mindfulness has growing empirical support for not just enhancing people who are in active substance use, but also in the prevention of the development of a substance use disorder and in enhancing people's recovery long-term. I have to move our little heads over to the other side so I can see the rest of the slide. So yoga and mindfulness does a really good job of enhancing emotional regulation. You feel a feeling and you don't let it control you. You're aware of that feeling. And it allows you to develop healthy coping skills, which I think Amy and Jenna may go into a little bit in terms of breathing and different things you can do within your body to heal. And when you have that alternative skill set, it gives you the opportunity to use those skills that enhance your life, that make you grow, rather than turning to drinking alcohol, taking a pill, those kinds of things. And it also provides sort of like a safe space for people to explore their emotions and physiological sensations, trauma that they've held in their bodies for a really, really long time. A substance use disorder, as everyone knows, doesn't develop overnight. Nobody thinks that they're going to be addicted to drugs or to alcohol or have that kind of a problem. It takes time to develop that problem, and it takes time to heal it. So what yoga and mindfulness does is it creates a safe space where people have that chance and that opportunity to observe and understand their own behavior. And that understanding leads to better, and I guess I hate to say understanding again, but I don't know another word, a better understanding of the way that your actions affect other people and yourself. And it's just a really great opportunity to build those new healthy coping skills, and something that our court really, really wanted to do and get behind. And I know the other courts do as well. So I think that's it. And so here's how we got started. The DWI court kind of led the way with the addition of yoga initially, and then later we expanded to mindfulness. I think in 2018 was when it started, and we had yoga sessions available for men and for women, and also for male and female team members. Those were taking place once a week, not at all tied to the court session, but that was just an opportunity to have a space where people could get together and get introduced to this type of a practice. Our sessions are gender specific, and that is a trauma-informed approach that we also use in our courts, just so that people have an opportunity to feel safe, where they might not necessarily have that sense of safety in a mixed gender group. And then later on, we decided to transition to gender-specific sessions that were offered immediately before court. So a person would go to yoga with Amy and then walk right across the hall and go to court. And the difference, anecdotally, that I had seen was palpable. If you can imagine going to court, you're brand new, you've never been in a treatment court before, you have this whole history of negative experiences with the criminal justice system, you're scared, you're intimidated. I work here and I still get intimidated going into a courtroom. So having that chance to practice right before court was very calming for a lot of our participants, and they were in a frame of mind where they could get the most out of the court hearings and court sessions. And then the pandemic hit, and that was rough for a lot of our people. I think it's Johan Hari who says that I'm probably not saying the name right, but I think he says that the opposite of addiction is connection. And the pandemic really hit people with substance use disorders hard, because connection is so critical to people's success, and it was just gone. So what we decided to do, and this was Amy's idea and Bian's idea as well, was offer the yoga and mindfulness sessions on a HIPAA compliant Zoom account. So that was a response that we took. And I think Amy will talk a little bit more in depth about this later. And now, as the governor's orders have lifted restrictions and the judicial branch begins to lift restrictions as well, we're looking at different ways that we could safely transition back into in-person sessions. I know the judge had talked about maybe we could do yoga outside in the park, and I think that would be a really good idea. And there are some spaces within the courthouse that we might be able to utilize as well. And I know, Alicia, you wanted to talk a little bit more about the expansion to other courts and how it's affected your court.
Yeah, so kind of hearing and watching what Duluth was doing and seeing the benefits being experienced by those participants, we were really eager to offer something to our folks up on the range. And those of you that are familiar with St. Louis County, the northern area, it's very, very rural. So today you're going to be meeting Jenna Dickinson, who I initially discovered in a newspaper article when she opened up a studio in Aurora. So I had reached out to her and I went and met with her in person, discussed treatment courts, and we invited her in to observe a session and to meet our team. Jenna practices trauma-informed yoga, and she's originally from the range. She has a really unique perspective, which you'll hear today. So we worked with her and Mary Jo and the extension program on developing a new program that we could offer the participants in our hybrid court. Our journey thus far also kind of started in the pandemic, so we had to pivot a little bit on what we would have, expected the program to look like. But we got creative and we developed a virtual hybrid type project that included, we pushed out a 4-month-long series of weekly sessions, and the weekly sessions included either a live session or pre-recorded sessions. And we encouraged journaling. We encouraged participants to journal after each session. And they were even given the opportunity to schedule one-on-one time if they wanted with Jenna. So with all the challenges our participants were facing over the last year, we were really excited to be able to offer something like this for the first time. And now that we're kind of coming out on the other side of the pandemic here, just even more excited to see where it'll go. So yeah, it's been a great experience and we're just excited to expand on it, but I think that's it, unless there's any questions up until this part for Rachel and I.
Well, then we'll pass it off to our colleague, Amy Fogarty, who's wonderful. And I'll let you introduce yourself, Amy.
Thank you, Rachel. Thank you, everyone. Thank you, Judge Anderson and Alicia, everyone who's worked to bring us all together and share this morning. So yeah, so I want to just chat a little bit about trauma-sensitive yoga and share a little bit about myself. So I'm Amy Fogarty. I'm a registered nurse by training, so I definitely have felt more comfortable in a hospital setting, and getting into the treatment courts was definitely something new for me and something really, really exciting. And it's just been an absolute honor to be a part of. And I could not imagine not doing this work. I feel so inspired by it, by the stories. I guided a men's mindfulness group last night, and every week it's so touching to have that time for connection and to just really see the impact that it has for individual participants. So I'll share a little bit about yoga and trauma-sensitive yoga. Deanne, do you mind popping to the next slide? Thank you. So what is yoga? I think in our culture, there is some confusion around truly what is yoga. I think of yoga as this beautiful gift from India that was developed thousands of years ago. And the word yoga means to yoke, like to bring together or to unite. So I think of it so much as this science of connection, right? And of well-being, and it's really designed to reduce suffering. So I think there's this idea that yoga is for certain people, or for, in the US, it's something that people practice at a gym and it's more fitness based. But I think of yoga as more of a a practice of connection to ourselves, to others, to the world around us, and that it's truly for everyone. So within the yoga space, we could practice, we can have our yoga practice be in a chair, we could be on the earth, people can practice yoga in a bed. So it's not something that is just for women, it's not something that's just for a gym, it's for everyone. And it goes far beyond what I think so many people think of as yoga, which are the physical postures. So Deanne, do you mind going to the next slide? So yoga has an 8-limb path, and these are from Patanjali's Yoga Sutras. But I think often, again, people focus on asana, or the third of the sutras, and think of yoga as just physical movement, or standing in a warrior posture. And really, yoga, the path of yoga, begins with ethical principles. And the first 2 ethical principles are non-harm and truthfulness. So every day we show up in our lives or in our practice, and we get current with what is true for us today, you know, taking a moment to connect inward, whether that's knowing what's true showing up in our physical body, what's showing up in our mind, emotions that are present, things that are on our heart. And then we're working to respond in a way to never cause harm. So whether we're moving in our body, never causing harm, or, you know, we're acting in our lives off the mat, again, never causing harm. And when we share the practice of yoga, it's not just these physical practices of asana, but we begin with ethical principles. So the first ethical principle, as I said, is non-harm, and then the second is truthfulness, and they come from the yamas. So there's a set of 10 ethical principles, 5 yamas and 5 niyamas, and I won't get into all of them today, but the niyamas also include practices like self-study, learning about ourselves, getting to know ourselves, so that we're responding, you know, consciously from our own wisdom, and then interfacing with the world with more responsiveness versus reactivity. The third limb of yoga, which is so often what people come to yoga thinking this is yoga, are postures. So we can move in our body, and we can find stillness. You know, what I'm seated right now, and this is seated mountain, and that is a posture. Or lying down on our back, that's also a posture. So we can find movement in our practice. We can find stillness. Again, it's about connection. The next limb of yoga is pranayama, or breath practices. So in yoga and in mindfulness groups, we take time to turn our awareness inward and to bring awareness to our breath. You know, with awareness of trauma-sensitive principles, also recognizing that even the practice of being with our breath can be a journey. So for some people, it can be really challenging to notice the breath, or when we bring awareness to the breath, it might create anxiety. So in addition to awareness of breath or breath practices, we can also practice awareness of our senses. And that's a connection to the mind as well, where we're noticing in this moment, what am I seeing, right? Like what am I seeing around me? What am I hearing? What am I feeling? And I mean, feeling the earth beneath our feet, maybe feeling the texture below our hands, noticing things we're smelling. So we can practice pranayama or breath practices. And even as an alternative, we can practice awareness of our senses. The next limb of yoga is pratyahara, or sense withdrawal. And I think of that as just that turning inward. So when we're practicing, again, yoga or mindfulness, often the invitation is to close the eyes or have a soft gaze, just taking our awareness from the outside world and drawing it inward. And we can even do that with our senses. So we might notice sounds, for example. You know, what are we hearing in terms of sounds outside our room? You know, do we hear the sound of the street right now, the sound of the birds? And then are there any sounds that we hear within our room? And then we might turn that awareness more inward and notice, do we hear the sound of our breath? Things like that. So just taking awareness from the outside back to ourselves. And with eyes closed, you know, it naturally sometimes just shifts that awareness inward. But again, with a trauma-sensitive approach, just being mindful that it's an option to close the eyes or have a soft gaze. And then dharana is focused concentration. And that's, you know, kind of part of the path of yoga. And I think of that as being in the moment. So we might be resting our awareness on our breath or on the experience, coming back to this moment. And then often at the end of practices, whether it's a yoga practice or our mindfulness group, we practice meditation. And again, it's kind of starting with this awareness from the outside, turning our awareness inward, and then just resting our awareness somewhere. So it might be noticing our breath and just sitting quietly watching our breath. Or it could be using a mantra or a supportive phrase for support, a settling sound, if you will. So it could be something like saying to ourselves, so hum, or it could be saying just this, or be here now. So something just to let our awareness come inward. And meditation is this practice of relaxation, of turning inward and being in the moment. And then the last of the limbs of yoga, and I think, you know, is samadhi. And I think people can think of that as like, you know, something strange outside of ourselves, but really it's joy, right? And joy is our birthright, you know, to have joy, to experience bliss, to experience connection to the world around us. I sometimes think of Samadhi is just kind of being in the flow, right? When we can just be so present in our lives that, again, we're responding rather than reacting. And it doesn't need to be something that lives outside of ourselves or feels intangible. It's just being in the moment, celebrating connection and lingering in joy, if you will. Vianne, if you don't mind going to the next slide. And then I wanted to share, so that's what is yoga, right? This gift from India. And what is trauma-centered, trauma-sensitive yoga? And that's the approach that I work to integrate into the yoga practices that I guide. I'm honored to have studied at Kripalu with Jen Turner and David Emerson. And I learned the trauma-sensitive yoga practice. So it is a program of the Center for Trauma and Embodiment at the Justice Resource Institute. It's empirically validated, and it's a clinical intervention for complex trauma or chronic treatment-resistant post-traumatic stress disorder, PTSD. It qualified for inclusion in the National Registry of Evidence-Based Programs and Practices, a database that was published by SAMHSA. And it's based on the central components of Hatha Yoga, that 8-limb path that we just talked about. And then it also has foundations in trauma theory, attachment theory, and neuroscience. So if you're interested in learning more about trauma-centered, trauma-sensitive yoga, I would encourage you to visit their website. They have a lot of wonderful research articles, and they'll go into even more depth than I'll go into today about trauma-sensitive yoga. So next slide, Vianne, thank you. So when I talk about trauma-sensitive yoga, it's always a mouthful, TCTSY. What are some of the key things? So what am I talking about really? It kind of sounds like a mouthful. Well, it's being in the present moment. So as we have a yoga practice, we work to come back to the moment that we're in right now. And practices that we can use to do that might be things like noticing our breath or feeling our feet on the ground, or again, noticing our senses, or being in our body, noticing what it feels like to be in a physical yoga posture. We also practice in yoga making choices. So I'll give a lot of ideas and options. And I say that whenever we're practicing yoga, the goal is that we're making it our own. So it's not that as I guide a yoga practice and share the practice of yoga, that we all should be doing the exact same thing in the exact same way at the exact same time. But it's about finding what feels just right for us today. And we'll have the opportunity to explore that a little bit in a practice in a few minutes. But when I say making choices, it might be something like, I'll give an idea of if we were taking sun breaths, we could inhale, letting our hands open, and exhale, letting our hands close. So that's one option, inhaling, hands opening, exhaling, hands closing. Or a second option could be to inhale, letting our hands float up in any way, and exhale, letting our hands float down. Or a third option might be to inhale, arms out around and up where palms could meet at the top, and we could exhale, hands to heart center. So when we're guiding yoga, we're saying it could be like this, or like this, or like that. And also then as we're making these choices, we're practicing taking effective action for ourselves. So all of us having autonomy, finding what feels just right for us in that moment. And it could be movement, it could be stillness. I might give 3 choices. That's not the end of the possibilities. Maybe someone has a different way they want to move in their body, or maybe they choose stillness. But it's about finding for themselves and making sure that people feel supported to take effective action within their practice. Or if they notice, like in seated, my feet don't touch the ground, I'll put a blanket below my feet, or, in the seated shape, I don't feel supported. So maybe I'll move up to a chair, things like that. That's the idea of taking effective action. So being so in the moment that we're listening to our body and then responding in a way that feels supportive. Another theme in TCTSY is creating rhythms. So we can create rhythms through movement, and we can create rhythms that are our own, right? We can create our own rhythm, and we can move in rhythm as a group. So in that example that I just gave of sun breaths, we could move in sun breaths together, flowing with the inhale, inhaling out around and up, exhaling hands to heart center. So we could all be flowing together in some sort of a movement, or we could be flowing with our own breath, right? Finding our own rhythm. And so during the practice in different parts, we might move together, we might move separately. And again, just making it our own. And maybe some of us are moving in rhythm together, and maybe someone is kind of moving to their own. And all of it is yoga, and all of it is right when we're finding what feels right for us in the moment. Yeah, thank you, man. Okay. So a couple other things I wanted to mention about trauma-sensitive yoga. So language of invitation is really important and emphasized when we utilize this approach. And what I mean when I say language of invitation, it's this idea that I'm never, as I'm guiding yoga, commanding people to do things. Like I won't say, okay, everybody stand up right now. I'll say, like, taking your time, if you'd like, the next option is to stand up. You prefer to stay on the earth, you could stay on the earth. So during the practice, it's making sure that people feel really grounded in the fact that it's your practice, your body, everything is a choice, that I'm not telling anyone what to do. So I'll say things such as, like, you might do this, or the next option is, or you can, or perhaps you'd like to, explore this, taking your own time when you're ready, when you feel complete. So it's always letting people, again, turn to their own inner wisdom as invitational language versus this me expert telling people what to do. So language of invitation, I love. Language of inquiry. So that's the invitation to, again, kind of turning from the outside, turning inside ourselves, being curious, noticing in the moment, what do we feel, as we begin our practice? Is there anything you're noticing today? Do you have tension or tightness? Or maybe you feel softness or ease, and just being with the present moment as you're in it, or noticing sensation in a specific part of the body. So as Rachel said, so many of us on the Zoom, are over computers, and our shoulders might carry tension. And so one way we might be curious is to let our shoulders float up, and just to notice, like, what does it feel like when my shoulders float up? And do I notice a sense of contraction there? And then what does it feel like to soften and release? And then to gently draw the shoulders down. So it's inviting people to have this experience of being in the body. And even I think of inquiry too as practicing those different choices, like that example of sun breaths, because I don't just know what it is I necessarily want in the moment, but being able to explore and find what's just right. So maybe you try this version of sun breaths, opening and closing, and then maybe you're curious and say, well, what would it feel like to float hands up and hands down? Or what about arms out around and up? Oh, my right shoulder sore. Just kidding. I'm going to put my arms back down. But allowing ourselves to be curious, to explore different things. And then again, going back to that, making choices, what feels right. Another aspect of trauma-centered, trauma-sensitive yoga is that we don't use hands-on assists. So within a yoga studio setting, sometimes yoga teachers have been trained to support people in their practice and help them, like they might walk around the room and they might say, oh, like this, or they might touch someone's shoulders. And within this way of sharing the yoga practice, I stay on my mat, as much as possible. I'm on my mat guiding the yoga practice, and almost never, in our group settings, use any sort of a hands-on assist. So it's verbal cueing. So you might do this, or you could do that, or you might align your front knee over your ankle. So it's cueing assists or words rather than hands-on. So that's another just important kind of key aspect for most of the time, right? I've worked in other settings where a participant has been blind, and they've said, if I'm doing this, could you come and assist me, right? Like that would be a different, unique situation, but generally we all keep our hands to ourselves. And then also working as a group to co-create just a quiet and peaceful environment. And like Rachel would help me set up our space at the courthouse, and we would go in and dim the lights and work to get the room set up just so, and then as participants come in, just letting them know like, oh, we have our cell phones put aside, and we're making our way to our mat, checking in, but just working as a group to say, or if you have to come in late, try to be somewhat quiet. It's definitely a little challenge sometimes in the courthouse to keep it quiet, because right before, as Rachel mentioned, once we transitioned to the courthouse, we would have yoga practices in the jury lounge, which were right across from the courtroom. And so sometimes as people were arriving for court, there'd be a bit of noise in the hall, and we would try to somewhat keep it quiet out in the hall. But even just normalizing that, right? I would just then say, oh, it sounds like people are getting ready or arriving, just naming things that we hear, but working together to, as much as we can, create what feels like, hopefully, a safe environment for everyone as a group. Okay, so the flow of a DWI treatment court group. So, what does this look like? Again, I shared about the 8 limbs of yoga, and I just wanted to share, like, what does this look like when we, walk into the jury lounge or we show up on the Zoom? The first thing is, just to check, like, welcome everyone and check in. So especially on the Zoom, the like, hello, how are you, just can be a little more challenging sometimes. So in the Zoom world, I always work to make sure that we just pause at the beginning and say hello, and check in with how are you today, and does anybody have a request for yoga? Maybe someone would say, my shoulders are feeling tight. Could we explore some movement there? Or, they might just share from the heart about something going on. So we just, work to create a little welcome check-in at the beginning. And then I'll usually share a theme or a topic of the day, so one week we might explore, breath as a theme, or it could be a theme of slowing down or being in the moment, grounding, so I'll just share on a specific theme, gratitude. And then within the practice, I love quotes and poems. So I'll usually share a quote at the beginning and a little poem at the end. And then as we start our practice and begin, taking our time to settle in, we just practice finding the just right place for us to begin. So some people are seated in a chair, some people might be lying down. We have chairs and yoga mats, when we're in person. And of course, people have whatever is within their home. And then we just take time to check in with ourselves. Like, what is showing up? What's true for me in my body, or what's showing up in my mind or on my breath? And I invite people to just draw that awareness kind of from the outside inward, coming to the moment, getting current with ourselves. And then from there, we'll explore movement. And I like to start with somatic movement, just gentle movements into the body. An example that I gave before was like letting the shoulders raise up. And when we feel the shoulders contracting, this is somatic movement, and then we consciously release. So it's like this little pendiculation into a contraction and then a conscious release, kind of noticing like, what does tension feel like, and what does softness feel like? So usually a few minutes of somatic movement, and then yoga posture exploration. So asana, so a little bit of movement. And towards the end, we'll either practice a little meditation or relaxation. And then the themes, like, or the other 8 limbs of yoga are somewhat just interwoven. So breath awareness, we might bring awareness at the beginning. We might notice our breath in the middle and bring awareness to it at the end. I'm always working to just bring mindfulness to the 8 limbs of yoga, right? Do no harm. Like, as I share the practice and with the trauma sensitive approach, like, how do I make sure that I'm not creating any harm within the room, and support everyone who's participating in yoga to not cause harm? Okay, and then at the end, we just close and check out. And when we're in court, we put the room back together, and then I would usually go to the men's court after. So the women would have courts or would have yoga, and then right after we'd have men's yoga. And then I just got so much out of listening in the court. So it's really wonderful to, after yoga, share and listen in the courtroom. So I think next slide, thank you. So I wanted to talk, Rachel mentioned it, but it has been a challenging year for everyone, right? Like COVID-19, wow, it's been a really tough year for participants. It's been a tough year on everyone just trying to navigate, this adjustment from normal life in person to our, virtual life, or a more disconnected life, for some of us that might feel that way. And then it'll be curious as we go back, right? And try to reconnect. But I wanted to talk about, what has COVID-19 meant for, for yoga? So prior to the pandemic, and these are a few pictures of us practicing yoga, yoga was offered in person and just prior to court, as Rachel said, and it seemed to be a supportive time and place to offer yoga. But then once the pandemic started, we needed to shift to virtual offerings because it was no longer deemed, safe for us as a group to meet in person, and also the courts transitioned to virtual. So at the time when we first started transitioning, we encountered that some of the men were saying, it was difficult to practice at home or find a space within their place, or they would have children. And so we explored a mindfulness group. And so for mindfulness, similar to yoga, it's the same amount of time, 45 minutes. We spend time checking in, and then we share a little bit more on a topic. So usually I have like a little 5 or 6 point PowerPoint slides on some sort of a topic that I share about. So some examples might be, I'll share about meditation. What is meditation and what's the practice? Why do we do it? Same thing with mindfulness. And as Rachel said, that we come back again and again to that John Kabat-Zinn quote, that mindfulness is the awareness that arises when we pay attention on purpose, non-judgmentally, and in the present moment. And so we come back to that so often in our groups. We've had topics on things like our values, and how values sometimes can come from the outside. And then what if we turn inward and check in with what's really important to me? How do I want to show up in my life? And, who do I want to be as a person in society, as a partner, as a parent, So we talk about things like that. We also will talk about boundaries, and the importance of setting boundaries is a topic. We can set boundaries ourselves, and then how important it also is to respect the boundaries of others. We'll talk about things like time in nature, or gratitude, or communication, or breath. I thought when I first started, I'll have 12 themes, and that's how many I'll need, and then we'll repeat because people were coming for 12 weeks. And what happened is some people have been coming since 2018. And so I have to have more themes. So I think I have like 42 PowerPoints for our mindfulness group right now because I want to keep it current and relevant. And certainly we cycle back and we'll talk about mindfulness, but I try to also share some different concepts so that people continue to find it supportive. Let's see. So that was the mindfulness group. It's been a challenge. We're working on trying to find the just right time for women for yoga. So that's something, we're working on and working through right now. Rachel mentioned, maybe getting back in person and offering yoga outside. I mean, that would be so wonderful. So some challenges, everything is trade-offs. So right now we're meeting virtually. And there's certainly some challenges with being in our homes, and then certainly some gifts, which we've all, I think, experienced, like this power of connection right now. Like, thank you, Zoom, that we can all connect and be together, but also certainly challenges. So I can pause for questions.
I have a question, Amy.
Mm-hmm.
You said a word I don't know. It was when you were talking about somatic yoga, and you said, I think it was pendiculation.
Yeah.
What does that mean?
Yeah, so pendiculation is just the conscious movement into a muscular contraction and then a mindful release, like kind of a slow, steady, mindful release. So in that example of like the shoulders floating up, where we feel our shoulders contracting and then we pause to notice that contraction, and then we gently unwind and release. That is a tool from somatic movement called pendiculation. And we can do it in any muscle group. So we bring like those two muscles together and notice where we're holding tension, and then we take a gentle release. And the point of doing that is that sometimes our muscles become habituated, as you said, like our body keeps the score, or our body is remembering these patterns of tension. So if we've been on the computer, or Minnesota, right? It's so cold in Minnesota. So every time all winter we go outside and we do this with our shoulders, and then pretty soon our shoulders kind of just remember to be up. And so when we actually go a little bit further into the contraction and pause there, and then really slowly release, we can unwind the tension more effectively than if we just said, release, 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 release the tension in your shoulders, put them down. You know, you tried to just put them down, but if you go a little further into the contraction and then that slow release, it's a really effective way of unwinding tension. So I love to share that with participants, and they seem to find it supportive. So
Thank you. I didn't know what that was, so I appreciate the explanation.
yeah.
Thank you.
Any other questions?
Well, I'm not seeing any in the chat. Does anyone want to unmute quickly or raise your hand? There's that little reaction button in the bottom part of your screen. I think we're good.
Thank you.
Bye, guys.
Alicia, would you like to introduce Jenna?
Yes, okay. So Jenna, if you are all set up, Jenna Dickinson is our provider up on the range that I mentioned earlier. So she's here to share her unique story. So Jenna, let you take it.
I'm Jenna, and can you guys all hear me? Can you give me a thumbs up if you can hear me? Because I can't see my screen. I don't know why I'm not popping up on there, which is okay, but thank you for having me. I feel privileged and grateful to be here this morning. Yoga came into my life at the perfect timing. Looking back at my life, yoga kind of always was in my life, but I never put a forefront on it. And so I'll share briefly kind of about myself, and then I'll share what yoga has done for me. So I live right kind of where I grew up. I live right in between Aurora and Biwabik right now, out by Embarrass Lake, if anyone is familiar with that. And that's where I grew up. I grew up in a family of, I just have older brothers, and I'm the youngest. And on the outside, my family looked like it was all put together and fine. And on the inside, you know, it was quite chaotic, and I had trauma experiences kind of throughout my childhood. And what helped me cope with that when I was little and through my adult life was I got, I'm athletic. And so I was really into athletics, and it served me a purpose for a while, but I was always really uncomfortable. And so in high school, I was successful at athletics, and then in college, I was successful too. But it led me into a path of, like I said, always being uncomfortable and always wanting more. So I was a college athlete, and the moment I met alcohol, that became my my coping with life. And so I met alcohol pretty much the first weekend I went off to college, and I was on a college ski team with half of my ski team was on the US ski team as well. So it was super, super competitive, and I became the party girl on that team. And so that led me into, you know, I finished college and I was a blackout drinker and that kind of thing. Looking back, I did yoga and I had that in my life, but I never, you know, I never paid attention to it. Going forward, I was an elementary teacher. And so my elementary teaching career, everything again looked fine on the outside, but on the inside, I was a total wreck. I was always uncomfortable. I was always, you know, stuck in my head about my own traumas, and I used alcohol and drugs to cope with that, and running. It was funny. The first time I went to treatment, my counselor said to me, you're just running through all your emotions. And I didn't want to listen to anyone. And, I think that's what trauma can do, is we don't want to listen to anyone because we're so stuck in our own self. And we're so stuck in not wanting to feel and grow. And so, we don't listen to anyone. So that was the first time I went to treatment. It was just a Band-Aid. I got out and I stayed sober, but again, I was always really uncomfortable. And I just used winning races and continuing to run and all that stuff to cope with my pain. I ended up getting married, and I had my first child. And in one of my yoga classes that I took, it was a birth through 18 trauma-informed yoga class. They said, when we have our own kids, we actually relive our traumas through our kids. And, looking back after having my first daughter, her name is Isa, I can see that. I started to live my own traumas as progressing as she, got older and whatever. She's 5 now. And I got sicker and sicker. So I stayed sober for the first year of her life. But again, I was running a lot, and I was just using other things to get me through life. And I had a major hip surgery when she was just over a year old. And so then I got hooked on pain pills. And again, it was that same thing. I just didn't want to feel, and I just wanted to be numb with life. And so I ended up going to treatment again in March of 2018. And I got out and I worked an AA program. So I finally started to want to listen, but I still was always really uncomfortable. And so I was trying my best to work an AA program. I had a sponsor. I was going to meetings, and I would be sober for a month, 2 months, 3 months, and then I would relapse. And it would be like a weekend relapse. And then I would stay sober for a little bit, and then I would relapse. And I would stay sober for a little bit, and I'd relapse. And this went on for about 9 months. And in January of that year, so I went to treatment, I relapsed in April that year. And so in January of that year, I went to a yoga retreat at Hazelton. And I thought, okay, this is what I need. But I didn't know what I was doing when I got out. I didn't have a daily practice. I wasn't ready, I guess, to fully surrender to yoga in my life. And so again, I had a couple relapses, and then my last relapse, I ended up going to jail. I ran to the liquor store and I downed some vodka out behind it, and I passed out. My plan was to basically end my life. I just couldn't stand the pain. I didn't know where to go. I didn't know what to do. I didn't know how to heal myself. And again, AA was helping me, but it wasn't really healing me. And so I ended up going to jail. Those cops saved my life. I'm so grateful for those cops. Cops and law enforcement and courts and everything, they help us reach our rock bottom, and I'm so grateful for that. And so I spent the night in jail, and I got out, and instead of my daughter, she was 3, instead of her running up to me and giving me a big hug and saying, "Hi, Mom," she hit me, and she should have hit me, because for me as a person, I get into fight and flight really quick. And so my go-to is I run, I flight. And so I'm not a yeller. I'm not a person that gets defensive or much. I'm a hider and a flighter. And so right before, as I was in that last relapse, my husband and I got in a physical altercation, and I pulled a knife on him. And so, thankfully no one got hurt and stuff, but I'm so thankful that my daughter, she came up and hit me because that was my rock bottom. I needed that. And I'll get probably teary-eyed because I just feel so bad. But and like everyone's saying, the body keeps a score. That is something I still haven't been able to work through. So which is a good thing because it helps me stay sober. So anyways, right then and there is when I knew I needed to change my whole life. So my husband and I basically got on board with yoga together, and yoga and AA have saved my life. So today, what it looks like for me now is, at the time I was teaching elementary school, when school got out that year, I basically went right to yoga training. And so I started doing yoga training through Yoga Fit. If anyone's heard of it, they're really emphasize trauma-informed yoga. And so I've taken several trainings for that. And my husband and I, we also listen to a daily podcast, it's a yoga podcast, and it's called Wisdom of Sages. And what it is it's bhakti yoga, and bhakti yoga and the 12 steps are really, really closely related. The language is the same, the being accountable for our own self, our own actions. So it helps me. But how yoga and AA have worked for me is AA gives me the foundation every day to live my life. Yoga gives me the foundation to heal each day, because when I wake up in the morning, some days I wake up feeling alive and joyous and free. Some days I wake up and I want to hide underneath a blanket and I don't want to do today. So every day I get up and I get to do my yoga practice, and I get to feel the feelings that I have for the day, and I get to notice what my body feels like. And then as I work through my day, and if anyone's familiar with the 12 steps, when we take our personal inventory, that's when I realize what's happening with me. Yoga helps me work through what's happening through me. So if I'm feeling really fearful, and that's generally where I go, I get to work through that, and I get to work through it by pretty much through my pranayama breath. When I'm going throughout my day, what saves me is my pranayama breath, feeling and noticing myself, grounding my feet, grounding if I'm sitting, my mindfulness of, changing my thought. If I'm triggered, and, I get triggered often, I have the power within me to change those thoughts, to bring myself back to the present moment. And it's only because of yoga and working my 12 steps that I get to do that. I'm in long-term recovery now, and it's wonderful. I'm so much better of a mom, and I show up for life, and each day I want to be of service to those around me. And before, even when I was working my 12 steps, I wasn't there. It's the yoga and the 12 steps that have brought me into healing myself, and to, also healing my family. And it's a wonderful thing. If anyone has questions, please ask. Like I said, my husband and I, we do it together. And each night we take a personal inventory. We say where we were fearful, where we were resentful, where our ego either got in the way or maybe it served us a purpose. Were we dishonest, and what were we dishonest for? And then what we're grateful for. And, working with the people, I guess, in the court system, allowing them to work with someone else, I guess, that, can talk about all these things of the fearful and the resentment and ego and stuff. That's too also where the healing really comes in. So, it's just basically taking a look at myself and where I'm at each day. And so Yeah, it's a beautiful gift.
And I just want to say thank you too. I just think your story is so inspirational, and I know you personally and get to see you and talk with you, and I just feel so lucky to have you in our programs and just truly admire your story.
Well, thank you, Alicia. I appreciate that. Thank you.
And I just want to echo that as well, that, and I wrote it in the chat, but Jenna, you are an inspiration to all of us. And when I first met you, it was, and I will talk a little bit about this at the end of our presentation, but I walked into our retreat that we were having that you were part of, and you were telling your story. And I'll never forget that moment of just knowing that this is where, like, the work that we are doing, it is supposed to, where I was supposed to be that day and where our work was supposed to be unfolding, and that you were supposed to be part of it. And it all came to fruition when Alicia was like, we're working with Jenna Dickinson. I'm like, our Jenna Dickinson? Like, anyway, so I am just grateful for you sharing your story and letting us come on this journey with you. So thank you.
Thank you.
Thank you, Jenna. You're a gift to our community and treatment courts for sure. So thanks for being here and sharing your story.
Thank you, Michelle.
I also want to echo that, Jenna. Thank you for sharing your powerful story and putting a face to the power of yoga and recovery. So thank you, Jenna.
Thank you.
So with that, I can try to put, having a face to the power of trauma-sensitive yoga is so powerful and meaningful. And I will only try to match that with numbers, which cannot equate to words that can be spoken, and like Jenna just spoke and courageously shared with us. So to briefly introduce myself, I'm Deanne. I'm a counseling psychologist, and I direct the Mind-Body Trauma Care Lab at the University of Minnesota, Duluth. And I'm so grateful to be a part of this team, to have been welcomed in. So I truly, truly appreciate that, you all. So also please know that you're welcome to ask questions at any time while I speak. I think our Q&A cushion at the end is going to be shortened. So please you're welcome to raise your hand or unmute or write in the chat. So a little bit of what we're doing here is expanding what we call a window of tolerance, which some of you might be familiar with that through dialectical behavioral therapy or other works. So what this is saying is that we all have a window in which we can tolerate different stressors, and we can regulate our emotions within that window. And then sometimes there are external events or internal cues that kind of bring us outside of our window, whether that, speaking of what Jenna shared in terms of fight and flight mode, that would indicate some sort of hyper arousal, so being above our window. And freeze has also been thrown in with fight, flight, and freeze. And so that would indicate some sort of numbing or dissociation or hypoarousal. But either way, whether you're going above or below your window, it's some sort of stimuli that is impacting your ability to regulate in that moment. And our hope through trauma-sensitive yoga is to be able to broaden that window so that you are able to regulate emotions within more of a space. So we try to do that with a few routes and through these ideas of septions. So septions kind of mean layers onto layers. And I like that imagery because I think about like the outer layer of our universe to us, to Earth, to all the space that becomes ultimately us and our subconscious. So one of these septions is proprioception. So our idea of balance, understanding of ourself and our body in relation to space. So you can imagine how yoga helps increase our sense of proprioception, specifically in the traditional, some of the westernized thoughts of yoga and movement. And then the key in trauma sensitive yoga is a term called interoception. So that's like the big word in trauma sensitive yoga, in which we try to increase interoception, where interoception is stuff that's inside of us, whether that's conscious or subconscious or unconscious. It's like our heart rate, our ability to sense when we're full or hungry, our ability to feel our emotions. And this is considered a bottom-up approach, in which we're starting with the inside and going up. So that's in contrast to some of the cognitive behavioral therapies in which it's top down. So starting with what's going on in our mind and then moving downwards. So by increasing awareness of what's going on with ourselves, then we can be attuned to the emotions that are happening and check in with those internal cues and expand our window of tolerance. So with that, there's also the idea of neuroception, which is part of polyvagal theory. So here, it's a really neuronal approach to all of this. So saying that all of this can shift to the neuronal level. So in polyvagal theory, there's your vagus nerve. And with that, regulates your autonomic, your parasympathetic nervous system. So in terms of rest and digest, rest and relaxation, it fosters that. So thinking about the below your window of tolerance. So by being able to be attuned to this, our internal cues, our relation to external cues. So essentially our brain, the subconscious parts of our brain are able to take in information around us. And subconsciously, we respond to that, whether that's fight, flight, or freeze, whether that's, so all the different ways in which we respond. So by being able to get a sense of our body and space, being able to be attuned to ourselves, we can literally change our understanding of ourselves in a neuronal level. And that is the power, the hope of trauma sensitive yoga. With that, I will share a little bit of data that we have collected in the Duluth DWI treatment court. So specifically, we're looking at whether or not people bring this mindfulness practice to their home space. So that's something that we care about, because when we think of also coming from a counseling psychology lens, one of the things about therapy is that usually it's once a week and we don't know what clients are doing in between. So with this, we are just trying to assess how often they practice mindfulness in their home. And while they're practicing in session with Amy, seeing how the quality of their practice in terms of their present moment awareness in that time. And then looking at positive and negative mood. So some mental health related outcomes. So as Amy shared with 42 PowerPoint, we actually have a lot of information across a long time. So this is all pandemic. So you'll see that over time, people have statistically significantly increased in their home mindfulness practice, with the average being 5.9 times a week, which is pretty significant if you think about that. That's about 6 out of 7 days in which people are practicing mindfulness for at least 10 minutes. And that was quite a strong correlation between the two. Then in terms of practice quality, in terms of people rating, seeing how present they are in the moment of practice, that was also a significant increase over time. And you can see here that people say that 83% of the time, they're really feeling like they're connecting with their body and being present in that moment, which I think is, it's more than what I can say on a given day. So that's a very meaningful figure. Positive mood was a little bit different. So that was more difficult to shift over time. I think given all the impacts of COVID, the fact that this didn't decrease is meaningful. And then we see that negative mood did decrease over time. So I hope that these numbers also add to provide more evidence for the power of trauma-sensitive yoga. And I will happily pass the baton back to Amy.
Thank you, Vianne. I always learn so much from you. I appreciate you sharing that. And I also just want to echo like so much gratitude for Jenna for sharing your story, and also just so inspirational. So I really appreciate that. So now I wanted to guide just a short yoga practice, and we'll just spend a couple minutes exploring some movement and a little bit of practice within our own unique situation wherever we are. So it won't be long because I know we have a few more slides to go through and we want to have time for questions, but Vianne, do you think I have 10 minutes? Based on, I can't tell like how many slides we have left, what would you gauge? 10 minutes for practice? Okay, thank you. So I want to invite everyone just to take care to set yourselves up in a way that would feel supportive for you. So I'm actually going to back myself away. And if anyone is feeling like you need to stand up for a moment, you need a break, a drink of water, or to just do anything different, feel free to do that right now. And I'm going to just back myself up to give some space. So I wanted to offer some movement today, just in a chair, or yoga practice, I should say, some movement, some stillness. And so you could practice in your own place. I'm going to just try to find the just right place for the camera to be here. And you could be seated in a chair. I'm going to be in a chair today. You could also be seated on the ground. So whatever serves you. Maybe you're in a room and you're leaning up against a headboard. So just find whatever would serve you, and then just check in with yourself. So even as I'm coming to this chair right now, I'm noticing my feet hardly touch the ground. So I can make a little adjustment and even put like a little blanket below my feet just to support that sense of grounding, like Jenna had mentioned. And as we practice, whether it's yoga or mindfulness, it's so much about being with our experience just as it is. So we can use so many things in life to move away from our experience, to move away from how we're feeling. And the practice of yoga or of mindfulness or meditation is to turn inward and to acknowledge what is showing up in the layer of my emotions or the layer of our physical body. So I hope everyone has found just a moment to get whatever you need and then to settle in. So I'm seated with my hands on my lap. And then wherever you are, however you're sitting, or maybe you're lying down, if it would feel okay for you today, perhaps just closing the eyes. So as we practice, remembering that everything I'll share in the practice is an invitation. So your eyes could be opened or your eyes could be closed. And then we're taking time here just to shift realms. Letting ourselves just kind of check out of this presentation for a moment and check in with ourselves. So arriving to this moment, do you feel your feet on the ground? Or do you feel support beneath you? So just sensing that connection to support. And then if you'd like, you could begin to just scan into your physical body. So noticing in your body right now, what are you feeling? As you scan into your body, are there any places of tightness or tension? Do you notice any places of constriction or pain? And without judging those sensations, you might let your mind's eye just travel there. And if it felt okay, you could just be with those sensations. Maybe just breathe with them. And then you might scan into your body and just shift your awareness. Noticing today if there are any places that feel relaxed, perhaps that feel expansive or at ease. maybe more of a soft quality. And you could let your mind's eye travel to those spaces or those places. And if you'd like, you might breathe with those sensations. Noticing how our body can hold opposites. And then you might notice right now if there's anything else you feel in your physical body, any other sensations or awareness. Letting the mind's eye just notice those sensations. You might be curious about them, noticing if they're more on the left or the right. Whatever you're feeling is more towards the front or the back. And as you're noticing whatever you're feeling, just acknowledging anything that's showing up on the layer of your mind, any thoughts that are present, or any emotions or moods. Without judging, just noticing. And then from here, you might bring awareness to either one of your senses or your breath. So sense awareness might be noticing sounds right now, things outside your room, things you can hear inside your room. Maybe noticing the sound of my voice or background sounds in my space. Can you hear the sound of your breath? You might notice anything you're seeing, or even with eyes closed, soft light. Is there anything you're smelling right now? Or anything you can feel? Talked about feeling the support beneath you. But you might even feel like what texture is below your hands. You might feel the temperature of your body. And if you'd like, if it would feel supportive, you could connect to your breath. And so for breath awareness, you might sense your breath at your nostrils or the bridge of your nose. Feeling the movement of air flowing in and flowing out. Inhaling, you might feel cooler. And exhaling warmer. Or you could follow the breath further into your body. Maybe sensing the breath around your heart. Or you might sense the breath drawing down towards center. And even though the breath is only moving into our lungs, when we connect to a diaphragmatic breath, we might sense the breath and the movement within our abdomen. So with each inhale, our abdomen might gently rise. And with each exhale, it might gently fall. So inhaling, rising, and exhaling, falling. Just watching the body being moved by the breath. And as you're breathing here, I'll just share with you a short quote from Eddie Heilsam. Sometimes the most important thing in a whole day is the rest we take between two deep breaths. So I'll invite you, if your eyes are closed, that if you want, you could just gently open them, coming back into our group. And then you might bring some movement into your body. So I'll give some ideas and options, just minding our time. But the first option would be to move into your shoulders. So options for shoulder movement might be to start by letting the shoulders float up. We talked about that before. You might feel the shoulders just contracting, that like it's cold outside, lifting. And then we could let our shoulders gently soften and release. We might gently even draw them down a little bit. So you could continue with that movement if it serves you. Noticing as you move, does this movement feel smooth or jagged? What do you notice as you move into contraction and then release? Any differences side to side? And if you wanted, the next time the shoulders floated up, you could even gently look up. And then as the shoulders float down, if it felt okay in your neck, you could gently look down. You could stay with that if you like, just taking your time, shoulders raising up, maybe gently looking up, and then shoulders releasing and perhaps gently drawing down. And then just coming back to center in your own time. Some other options for shoulder movement might be to take little shoulder circles. We could take our shoulders up, back and around. We can make our shoulder circles small or larger. Our hands could stay on our lap as one option, or we could even bring our hands to our elbows and make like little circles with our elbows. So all of us just making our practice our own and moving in our own rhythm, in our own time. And if you took shoulder circles one direction, maybe you want to switch directions. Maybe there's a different shoulder movement you'd like to take. Feeling free to do that as well. Now when you feel complete, just letting yourself come back to stillness, coming back to center. And then from center, the next option might be to move into our center a little bit. So I'm seated on a chair and I'm just going to scoot forward a little bit just to give a little space between my back and the back of the chair. So if you'd like, we could move from the center of our body, letting the mid-spine arch forward. We might find that when we do that, our tailbone glides back. We can even gently glide the shoulders back just a little bit and perhaps look up. Then we could come back to center, so coming back to neutral. And then the next option would be to explore the opposite movement pattern. So you might round the spine like a cat. And you might feel like the tailbone glides forward. My shoulders automatically just came forward. You could explore that and perhaps gently looking down. And then coming back to neutral, and you could move through that a few times in your own pace. I sometimes just let my hands glide on my lap, looking up. And then coming back to neutral, spine rounding like a cat, shoulders coming forward, head coming down. You could flow with your breath. You could move at my rhythm, inhaling up, the mid-spine coming forward, and exhaling down, spine rounding towards the back of the chair. Feeling free to take just a couple more. Maybe inhaling up and exhaling down. And then just returning to neutral. And then from neutral, we could take a few sun breaths together. So options for sun breaths, again, all of us making the practice our own, could be to inhale, letting our hands open, to exhale, letting our hands close. That's option one. Or option two might be to inhale, letting our hands float up, and to exhale, letting our hands float down. Or third option could be to inhale our arms out around and up, where our palms meet at the top, and then we exhale, hands to heart center. So flowing at my pace or your own, you could inhale and exhale. You might inhale, then exhale. Feeling free to take one more sun breath any way you'd like. And then just coming back to center as you find completion. Letting yourself find stillness here for a moment. And then I'll invite you, if you'd like, just to move into an ankle. So feeling free to bring one foot forward and if you want, you could point and flex at your ankle, or you could take little circles. Just going until you feel complete. Noticing what you feel here in the ankle or the back of your leg, your toes. And then letting that foot come down when you're ready. And then you could take it to the other side. So just a little ankle movement, pointing, flexing, or circles if you'd like. Just like shoulder circles, you could do a few one direction or the opposite. Just noticing what you feel here. Sometimes one leg feels a little different than the other. And then just finding completion, coming back to neutral. And then from neutral, short practice today, I'm just going to invite you to come back to seated mountain. So any seated posture. Your hands might rest on your lap. If it feels okay, just gently closing your eyes. Again, your choice. Eyes could be open or closed. And as you settle in here, you might just come back to your breath. Just noticing what you're feeling in your body. Letting go of the doing of our practice, letting go of the movement, and just settling in for a few moments of being. As you rest here in stillness, I'll just share with you a closing poem called Walk Slowly by Dana Fall. It only takes a reminder to breathe, a moment to be still. And just like that, something in me settles, softens, makes space for imperfection. The harsh voice of judgment drops to a whisper, and I remember again that life isn't a relay race, that we will all cross the finish line, that waking up to life is what we were born for. As many times as I forget, catch myself charging forward without even knowing where I'm going. That many times I can make the choice to stop, to breathe, and to be, and to walk slowly into the mystery. So when you feel ready, just feeling free to bring in some gentle movement. Again, maybe you're opening and closing your hands, or rolling wrists or ankles, or stretching in any way you'd like. Just coming back from our short yoga practice. And thank you. So pretty short today, but hopefully that gives you just a little bit of an idea of what yoga is like.
Thank you, Amy. See in the chat. I feel really good. I loved it. Thank you so much. That's wonderful. Thank you, Amy. And I've had the chance, not so much lately, but in the past, to attend some of the yoga sessions that Amy guides, and it's just such a wonderful experience. So thank you for doing that, Amy. I just wanted to share a little bit about some of the perspectives from participants, and what we have here on our slides is quotes from participants in the men's mindfulness group, the men's yoga group, and also the women's yoga group. And I always, like Amy, I love quotes because I feel like these little anecdotes and snippets are a great way to, what is data but a collection of anecdotes? So I really like to see some of these. And if you wouldn't mind, Vian, going back to the first page, because there's one on there that I wanted to point out in particular. Oh, maybe not this page. I'm sorry. I got them all mixed up. Maybe the next slide is good. some of our yoga practices, we did have our team members attend. I've had the opportunity to go, and you'll hear people talk about how today's practice feels wonderful. I feel so reconnected head to toe. And it's important, particularly for staff members who work with people, to work on also healing their own secondary trauma that can come from dealing with participants and trying to guide them through their problems, and to make sure that you have a supportive space where you can also have that time to reconnect to your own body. Some of the men from men's yoga, and I just love this last quote that's in bold at the bottom. This was from a man who on his graduation day, he wanted to say something about the yoga program. And what he said was, whatever the postures are, it opens something up and makes things that aren't supposed to be possible. And the room just kind of went silent and took that all in. And I thought, you know, that's wonderful. He had come from a really dark space where he was having a lot of trouble with his children, a lot of struggles with his substance use. And to know that yoga was supportive for him in terms of getting to a point of recovery and a place of recovery and to graduation. And he's doing great now, actually. So that just really resonated with me. Another woman in one of the women's yoga sessions said that yoga, she felt, was much more therapeutic and beneficial for her to be practicing yoga and reading some of the books that Amy had recommended, rather than seeing a therapist. And it helped her to practice her breathing, helped with her anxiety, and helped with her stress. And she was able to recall and remember some of those recommendations from Amy, like books like The Four Agreements, the Yamas and Niyamas, and poetry. Amy always shares that at the end of every session. And what do we have on our next slide? I won't read this whole thing because I know we are short on time, but I think everyone has a copy of the slides also. But this was from a woman who graduated, and she had provided her feedback on the weekly surveys, the pre-program survey, the post-program survey, all the data and information that we collect, because we want to make sure that what we're doing is supportive for participants. But she wanted to write a letter to Amy and to the team, just sharing some of her feelings about the DWI Court Yoga program and how supportive it was for her. And you can see at the bottom, she says, I can't even describe how amazing I feel. After yoga especially, I feel like I'm overflowing with exuberance, and I just want to spread my happiness with everyone. Thank you so much for this program. And I recall that Amy talked about the different principles of yoga, and the last one was about that sense of joy. And I think you can really perceive that sense of joy here, where she talks about feeling really exuberant after doing the program. So that's great. And what do we have next? This is where we're going to go in the future. Are you ready? I almost wonder if maybe we should skip this poll question just for time's sake, because I really would like to hear a little bit more from Mary Jo too. Maybe I'll talk about this, Mary Jo, and then I'll introduce you, and you can say who you are, because I think you have more to say on the next one. And I just wanted to give sort of an idea of how we integrated yoga into the DWI Court program. It is a required element of the program. You must complete 12 sessions of yoga or mindfulness in order to successfully graduate from the program. And this is pre-COVID-19 what we were doing. We further incentivize, if you attend 12 consecutive weeks, then you can be discharged 3 months early from probation. And several people did take advantage of that opportunity, which was really nice. And it enabled us, particularly in the men's group, to get past some of the preconceptions that people have about yoga and encourage them to try something new. And this was the quote I was looking for earlier from one of our men that I couldn't find, so I'll paraphrase here what he says. He talked about how yoga has a stigma of being feminine, and how that was a barrier for him when he first started participating in the yoga program. But that after a few sessions of going, that he got past that and was able to focus on his own self and do his own thing. So yoga has been really great particularly for the men in terms of challenging some of those preconceptions that people may have. We also start yoga and mindfulness right away. Part of the success of the treatment courts in general and the DWI court in particular is we want to engage with participants as close to point of arrest as possible when they're most vulnerable. So we'll be talking with people right away. They're either, sometimes we talk with them, they're still in jail, or we're talking with them really close to when they get out of jail and starting to offer some of these interventions. And yoga and mindfulness fit in really well with that phase of the program, because that's when people are really at their most vulnerable. They've just been arrested on a new charge. They're new, a lot of them, to recovery and to even attempting to be sober. So people are really, really vulnerable. And we wanted to have something like the yoga sessions and mindfulness sessions to be able to support people through some of those vulnerable, uncomfortable feelings. And during COVID-19, yoga was really fully integrated into the DWI, or prior to COVID-19, it was really well integrated. After COVID, we've made some adaptations, and I'll just skim through this quickly because I know Amy talked a lot about this as well. We did relax the requirement for 12 sessions and for 12 consecutive sessions. And that's because our focus really changed from some of those more compliance-based things to helping our participants survive. The wake of the pandemic was really, really hard on people. We had a very serious overdose that nearly resulted in a participant death. We had our person get a new felony DWI, and that's because of the lack of connection and support that people were experiencing, especially right at the start of the pandemic. But I think it's important to note that once we did start offering yoga virtually, and then later also mindfulness virtually, people came and it was meaningful for them. It created that space for connection and camaraderie that was really missing from a lot of people's lives. And we also we went to Park Point in Duluth, which is a sandbar along the shores of Lake Superior, and we did a mindfulness walk. And Amy led that, and that was wonderful. We did one for the women and one for the men. So that was a way that we were able to reintegrate yoga and mindfulness back into an in-person setting. What's next? Let's see. So we wanted to, in the future, we do, as I think we've talked about before, we want to transition back to those in-person sessions. We want to look at maybe doing yoga in a park, which would be really cool. And eventually, I think it would be great if we can expand yoga to all treatment courts in the 6th district. And I think the next slides are talking about funding, if I recall. Yeah, so how do we pay for this, right? That's always the question. Initially, we approached some local foundations and grantors. The Duluth Superior Area Community Foundation was our first funder. And then we transitioned to the Victory Fund, and they were able to give us some funding to support the yoga program. And interestingly, at that point, we were just doing it in the DWI court. And then we also began offering sessions to the Duluth Mental Health Court and the Duluth Drug Court. So there were more sessions, which meant we were expending more funds, which created a little bit of a problem, because that brought our spending amount to a new threshold, which brought some additional scrutiny to the way that we were funding our program. And unfortunately, the judicial branch has determined that that yoga and mindfulness and health and wellness programming is not an expense that is allowable for judicial branch controlled funds. So we had to problem solve. And the way that we got around that was by connecting with some of our partners, nonprofit agencies who could be fiscal sponsors and stewards of those funds for us. And we would write grants in collaboration with our fiscal sponsors. And our partnerships are really strong, so they were willing to take on that additional fiscal responsibility with the grant writing support. So that was a great way to get around it. And Mary Jo, I didn't get a chance to introduce you, but I wanted you to have a chance to maybe introduce yourself and then talk about the SAMHSA opportunity and how that relates to our U of M extension partnership.
Sure, I'll just spend a few minutes and then I will put our website into the chat, but I know there were some questions in the chat as well. So my name is Mary Jo Patras and I am with University of Minnesota Extension. And a few years ago, we had the opportunity to secure some funding that really focused around recovery from opioid use and substance use disorders in rural counties of Minnesota. And so we really focused around the Northeast. But we were really fortunate to be able to really build some strong relationships within those counties and really learn and take that community engaged approach to really learning what the communities need. One of the things that it's just, as I'm sitting here listening to all these amazing stories, just amazing ways that we help folks in recovery stay in recovery, and how all of these resources and people come together to do that. I'm just reminded of the power of relationships, and how with conversations like these, with creating space like this opportunity today, how we learn about the work of each other and we learn about ways to support each other. And that's how our kind of relationship with treatment court started. We had several grants that really focused on funding recovery initiatives, what we're helping people in recovery stay in recovery. And from a university perspective, from a research perspective, of course we can guess, we can look at best practices, but we really wanted those things to emerge from the community. And so what were those things that were going to help to build capacity within a recovery community, as well as sustainability. And so meeting Jenna at one of our Changemaker retreats, which you can read on our website, and then also connecting with Lindsay Snewstad from the treatment courts, as well as Rachel and Alicia, we really started to come together to be able to create ways to support each other. And so that all of that was talked about today, a little piece of it, because we came in at the end, but our work kind of came in around the time right before COVID, if my memory serves me correct, started to help to support and really connect with treatment courts and support some of this work. So it's just a good reminder that there is partnerships out there, and through relationships and conversation, we can support this work and move it forward to having greater impact. I will stop there. I know we have 5 minutes left. If there are questions, I would love, I think there's some chatter going on in the chat, but and Rebecca, not going to take over, but if there are people that want to unmute and ask questions, please do. And I'll put some links in the chat too, and my email too, if anyone wants to follow up with me. Thank you.
Thank you, Mary Jo. I think we're ready for questions, so just in the nick of time. We have 4 minutes.
Well, why don't we have Vianne stop her share so that we can see each other while we have a conversation, and see if there are any questions from those who are here in attendance with us. This has been a very valuable morning. I had lots of questions, and Vianne has been very helpful in trying to answer some of them, but let's hear from others.
I think, especially with the treatment court pieces, I didn't try to answer since that's outside my forte, but I just spoke to how, like, within a 200-hour teacher training, typical 200-hour teacher training, maybe if we're lucky, 10 to 15 hours might be involved in trauma sensitive nature.
Well, I really want to look into that book that you recommended. the Restorative Yoga for Racial and Ethnic Based Stress. That sounds like something I would love. And if there's anyone here who has read that and would like to talk about it again, I'd love to do more in this area as far as echoes and Friday forums. So yeah, that sounds amazing. One of my,
Oh, go ahead.
I was gonna say, one of my questions was about what do we know about the rest of Minnesota? You talked about the 3 courts that you reached up in the Northeast, but how prevalent is this in other treatments, DWI, mental health courts, in other places?
Alicia, are you aware of any other courts in the state that are doing this?
I am not aware of anybody else doing it. And I'd say that our district, like Mary Jo touched on, we work really hard with our partners and networking and those relationships. We've had some really unique opportunities, but I think we're all really driven to make those connections with each other in our communities. So I am not aware of anybody else doing it, but hopefully we're having a ripple effect down the state line as well.
Right, I think so. And we have the DWI court has presented on our trauma-informed yoga program at the National Association for Drug Court Professionals National Conference. That was in 2019 when we were allowed to have conferences. But yeah, we did get the word out, and we had a lot of questions from other jurisdictions across the country about how to get a program like this started. I'd have to do a little more research.
One thing that came to mind for me was you need to do this similar kind of presentation at the OJP annual conference, or is it biannual? It would be a great place to reach a lot of people.
That's the Office of Justice Programs.
Mm-hmm.
Just making sure.
Any other questions? We are right at 11 o'clock. And I just want to say thank you to all our presenters and for taking this bold leap, right? For trying something new that is so old, right? and making use of some knowledge that we've had in a new way. I want to say thank you for what you're doing, and I hope that we can pass this on. I think it's something that treatment centers could benefit from knowing more about. I mean, some of them offer yoga, trauma-informed yoga, but not all of us do. And I think that could be another step in helping people, find that recovery path and give them an empowerment to stay on it, a tool and a practice. Are there any other last words from any of our presenters before we let everyone go on with their day?
I just want to say thank you for having us.
I'm so excited about this, and I'm so very grateful. We will be sending out an evaluation form. It'll come in the form of a constant contact survey. I also want to remind you that we sent out a link to an evaluation online form that helps with Mary Jo and the SAMHSA grant process that helps fund this. So 2 evaluations, both are really important. And we will also follow up with certificates of attendance for everyone. So thank you so much for being here. Have a wonderful weekend, and hope to see you again soon at a future event.
Thank you.
Thank you.
Thank you, everyone. Bye.
Thank you.
Okay.